Breast cancer, one of the most common cancers. Patients have an option with a more advanced, precise radiation, which is being used at Geisinger Holy Spirit. In this week's Doc Talk, Chris Nallen spoke with one patient about her experience with the SAVI device.
The following segment is sponsored by Geisinger Holy Spirit.
With a diagnosis like this, it doesn't end with your surgery. It doesn't end with the radiation.
Paula Baltimore was diagnosed with breast cancer in July of 2018. At the time, doctors at Geisinger Holy Spirit suggested two options, a lumpectomy or a total mastectomy of the left breast.
Because of the early stage of the cancer, I chose the lumpectomy and needed radiation.
Dr. Heather Theme, a surgeon at Geisinger Holy Spirit.
The problem with only doing that smaller surgery is that if it's not followed by some other treatment, the recurrence rate can be as high as 40%.
Paula was a candidate for receiving the advanced treatment called SAVI, a precise radiation therapy for early stage breast cancer.
I would completely encourage any person who was diagnosed with a level of cancer that would permit this type of treatment.
Theme notes that from a medical standpoint, all of the cancer must be completely removed first. She further explains how this precise form of radiation works.
This slips into the cavity where the cancer's been removed, and these struts are expanded.
Radiation travels through each catheter to deliver a precise dose, customized for the exact size, shape, or location of the tumor cavity, this getting right to the point.
So the total treatment time ends up being much shorter than what we had traditionally given for radiation treatments.
The end result is a greater success rate when adding the SAVI device into the mix of treating this common cancer.
By using radiation after the partial breast removal, the cancer recurrence rates are about equal to mastectomy. So that's the goal of doing this.
Precision radiation also brings another advantage.
The advantage for the patient is that she has much less cosmetic changes that she has to live with.
Today, Paula grateful for this treatment that was a success.
But this was wonderful. It was really good. Again, given the circumstances.
For this week's Doc Talk, I'm Chris Nallen.
Thank you, Chris.